Ladies and gentlemen, welcome to Module 3, which is the grand finale of our series on all ceramic restorations.
We're going to go into detail into the two-body group and in specific the high-strength core all ceramics, or what is probably most famous now is the porcelain fused to zirconia, and also the working horse of dentistry, porcelain fused to metal. And as we promised you always, we're going to answer the questions of why, when, and where is best to choose these specific materials for each clinical situation. So far we have covered all of the one-body group, and we're going to concentrate on the two-body group for the next few minutes. And in particular, the high-strength core all ceramics. And what we mean by the two-body group, as we said earlier, we've got the alumina, the zirconia, and the PFM restorations. We're not going to go into the porcelain fused to alumina because alumina really is not used that often nowadays in 2011, and most of the practitioners are heading towards the porcelain fused to zirconia restorations and the good old porcelain fused to metal. So when we talk about zirconia as a substrate for restorations on teeth, there's something that has been going around for a while, which is zirconia restoration translucent or opaque? And does this substrate really, where does it fall into the translucent area or the opaque area? And it has to go on either one of those. It cannot be translucent and opaque at the same time. And I'm going to try to demonstrate that through a case where actually we have done that in the early stages of zirconia, where it was still in the experimental stage and we didn't know really much about the optical properties of zirconia restorations. In this instance, after the teeth have been prepared, you see the differences in substrate. We've got the highly discolored abutments and fairly good colored abutments. So we were kind of new on the zirconia restoration. We said, you know what, let's use the zirconia-based restorations. And as we know, zirconia mainly are made out of machined centers. And the main two ways to make zirconia is either by the Procera way or the Cavo way. And what I mean by that is, when you talk about the Procera technique, is the stylus that actually physically goes around your die and scans it using this stylus that touches up the die, goes all over and scans all the intricate details of it, and then afterwards produces for you a virtual die where you can wax on top of it and then produce your zirconium coping. We've got also the Cavo way, or the scanning optical scanners, where you put your die in an optical scanner and the machine basically takes about 15 to 20 different pictures from different angles. And you can also scan your wax up, and then you can double scan both of them, meaning you can overlap your wax up onto your die and you can provide an anatomical cutback of your coping. And in that instance, we used the Procera. It was in the very early stages of zirconia, and everything looks nice really on the casts, because the casts are white and we really cannot see the influence of the discolored abutments. But once we put them in the patient's mouth, unfortunately the discolored abutments really show through these zirconia-based restorations. You see the two central incisors are more grayish, and if you remember from the previous slide, after we prepared the teeth, the two centrals are actually highly discolored. And so everything really is summarized in terms of translucency and opacity in this study done by Baldessara. And what the conclusion of it really is that zirconia restorations if they are within a 0.5 millimeter thickness, they are very translucent. They're almost as translucent as Emax restorations. So, to answer the question of is zirconia translucent, the answer is yes, it is translucent, especially if it's used in thin sections, which in dentistry we always go for thin sections because of lack of space. Now, we tried to demonstrate the concept of light transmission through a case where the copings have been measured, and in the midsection of it, you see the coping thickness is about 0.4 to 0.5 millimeter thickness. We put those copings straight on the dies and then shoot some light from the backside, and you see how the light is being transmitted through those dies, and you see the outline of the stone die through the zirconia coping. That's very interesting, isn't it? And we tried to put some black plastic cylinders right under these copings and just shoot some light from under it. And you see the black cylinders are showing through really as much as possible. And even when you layer porcelain on top of it, you still see the shadow of that black cylinder. We even tried a different color using a red cylinder. We fired some light, and you still see the red through the coping. And after applying the ceramic, this is an actual case on patients with proper space and all that. And you see still in the middle of the crown, you see the outline of the reddish plastic cylinder. So we covered the single unit teeth in terms of translucency and opacity of zirconia restorations. But what about fixed partial dentures? And how can we apply zirconia into bridges? And is that really possible? The main thing with fixed partial dentures is really the connector size. The connector size has to be of a certain dimension to allow for maximum strength to reduce the fractures of it. You see in this picture from an article by Ariel Regrodsky, just note the size of the connectors. Does that really look biological, or does that really look any good for you? When you compare it to regular porcelain fused to metal bridge, you see the connectors are much less because the metal is much stronger. And of course, when we compare it to the gold restorations, the connectors are much, much smaller because we don't have to really provide space for the ceramics. So everything is trying to make sense now in terms of the connectors, that when we go towards all ceramics used on fixed partial dentures, you have to provide big, thick connectors that oftentimes are biologically unacceptable. What about the issue of chipping of zirconia? We looked over the literature that has been published over the last 10 years, and the main pattern that has been published about zirconia is really the chipping of these restorations. You see on some of those clinical trials, 50% rate of chipping over 5 years. That is unacceptable on a daily practice. You see all these pictures from all these articles. They see the fractures are most of the time on molars, where we know that the location of the arch is of prime importance and the forces are really high. And you see the fractures are always on the distal side most of the time, and most of the time on the cusp tips. Again, a few more pictures as well from different publications. Again, most of the time on molars and on cusp tips. So that gives us an idea that really the support for the feldspathic restoration or for the feldspathic veneering structure is very important. And there's nothing magical about zirconia. We have to apply the same principles as porcelain fused to metal in terms of support. So we try to come up with some solutions to maybe reduce the amount of chipping of those restorations. Number one is provide proximal wings. After you make your full contour wax up, when you cut it back and when you provide your framework design, keep those mesial and distal parts of your restorations in zirconia. So that provides as best support as possible for the veneering structure. Let's have a look at the outline and how that gives good support for the occlusal load. What about lingual wings? We can provide a thick lingual collar, especially on the maxillary teeth where the functional cusp is the palatal cusp. And we can provide a thick lingual collar on the palatal cusp that can give us extreme good support for that particular cusp. What about providing proximal and lingual wings at the same time? All around. Make the best out of the white or the tooth-colored restoration zirconia and give even support for the porcelain on top of it. Always have to have anatomical cutbacks. In the old days, we used to provide cutbacks that were really just 0.4 or 0.5 millimeter even layer, and that provides amazing amount of unsupported porcelain, and that's where the chipping most of the time happens. But nowadays we know better, and we know that we have to provide anatomical cutbacks for our restorations. In this instance, it's an actual case where we used full restorations made out of zirconia based. Again, the same as we learned in porcelain fused to metal, anatomical cutbacks, the same way as in we can get beautiful results with porcelain fused to metal, the same way we can apply it to zirconia. And this video is just to show you the type of the how virtually you can provide this support on the lingual collars or the proximal and the lingual side of the copings. I'm just going to go through the video quickly, and just to show you here on the molar side where you can easily add wax virtually to the coping on the mesial and the distal side to provide that support on either side. Again, we see here how the technician is adding wax virtually on the die on the areas where we can have better support and better strength. Well, the same goes also for implant restorations, where we can also design our frameworks where we can provide lingual collars for those implant restorations. You see in this instance, the two implant restorations on the lateral and the canine position where we added this lingual collar to provide additional strength for the fixed partial denture on the implants, and still the restorations can look beautiful and aesthetics is really not compromised at all. Alright then, how can we take the best out of the zirconia white restorations? We know that zirconia is white or tooth colored, but how can we make the best out of that? And really there are four advantages of zirconia being white. Number one, we can use it on malpositioned implants and malpositioned teeth. And also we can use it when we are matching a restoration to a really high value or bleached tooth, and zirconia is probably the best substrate because it has this already a white substrate that can allow the matching to be easier. And patients demand for white, pasty white restorations, especially on the posterior molars, as Mamali have showed earlier with the one body high strength materials, where you can use a full contour posterior restoration and made through and through out of zirconia. So I'm going to demonstrate that with a case here where the implant restoration has been placed and it's a bit more towards the buccal area. It's not quite going through the buccal surface, but it's not really in the center of the occlusal surface as well. So it's somewhere in between. And if you'd like to keep the restoration in a screw retained pattern, we see here we can design the framework to be made out of zirconia, providing good support for the veneering structure. And you see the occlusal, or the chimney of the implant restoration, is more towards the facial side. But as we said earlier, that zirconia restorations have the translucency option of it when it's in thin sections. So we see on the facial aspect is very minute amount of feldspathic porcelain has been placed, and that's how it looks like on the facial aspect. And when we just shoot light from the facial view, you see how the light transmits really nicely through the feldspathic and the zirconia wall. That's because the zirconia is very thin over there. We kept the definitive restoration as screw retained, and you see here in the patient's mouth it blends really very nicely. You can't even tell which is which. And that's by proper manipulation of the material. That's how we got the successful result. Again, we've got an issue sometimes where we have a malaligned tooth, where the tooth is a bit more on the buccal side, and you really do not. You want to be more on the conservative side, and you don't want to prepare more because you might have an issue of pulp exposure, and then going into the root canal treatment and maybe a possible post and so on and so forth. So using a thin zirconia coping and matching it to the adjacent tooth, which also can be a high value, zirconia restorations are really useful in these instances.
So we've talked about the material, we've talked about zirconia and all the other different types of ceramics, and now we're going to shift over and focus in on another aspect of aesthetics, and that particular aspect is the influence of the soft tissue on material selection. So let's use some examples to demonstrate that to us. A patient who is about to lose a central incisor, patient with a high smile line and a high aesthetic demand. How are we going to manage this in order to get optimal results in terms of aesthetics and material selection, and what influence does the soft tissue have over all of this? In this particular instance, in order to test to see what material and what abutment will be best for this patient, we decided to use 3 different abutments. And we looked at these abutments from different views, from the occlusal and the facial view. And once you take a look at the soft tissues, what is it that you can see? You can simply see that really the abutments don't really play any influence. They have no influence over the soft tissues. And why is that? Because really, the soft tissues are thick. Now, my question to you, and this is what I want you to think about before I answer the question, is that how thick should those soft tissues be so that the material underneath doesn't really show through? So think about that. And then we move on and we show you the final restorations. You can see that although we use a particular type of material as an abutment, I'm not going to tell you which one yet, we managed to basically avoid the fact that it is showing through underneath. It is basically irrelevant. And that's because our tissues are of a particular thickness. And as long as they're thick, we're okay, we can get away with any kind of abutment. Another case. In this case, the patient has thin tissues. And when the patient has thin tissues, the abutments will show through. And this is where it becomes critical. So patients with thin tissues and a high smile line, those are the ones that we have to be very careful of in terms of restorative dentistry, because whatever we do will be visible. So patient again has lost another central incisor, implant angulation is quite facial, and the tissues are extremely thin. So we can see we're getting into a sort of difficult arena in terms of restoration of these patients. Patient with a gold abutment, and you can see the abutment color through the soft tissues. Patient now has a zirconium abutment in there. Again, we can see the zirconium abutment through the soft tissue. But interestingly enough, we could even see the gold screw, or in this instance, the silver screw has an influence on the soft tissue color. It gives it that gray color and that sort of lower value effect on the soft tissues will have an influence on the definitive restoration as well. So the color of the screw has an influence. There's a difference between a gold screw and a titanium screw when we have a zirconium abutment with thin tissues. All of these factors will play an influence. So this is how it was restored. It was restored with a zirconium abutment and a gold screw, and this is the definitive restoration in place. With a lot of trouble, a lot of difficulty to get these two to match and get nice looking definitive restorations. So I told you that I will tell you about details of studies to answer some of these questions in terms of materials and in terms of soft tissue thickness, and here they are. Let's look at some clinical studies. A study by Bresson basically addressed one aspect, and what they found was that they compared the different abutments that we've just been looking at, the gold, the zirconia, and the titanium abutment, and they basically found that zirconia and gold abutments are significantly better than the titanium abutments because they don't look so bad as they're traversing, the light's going through the soft tissues to hit them. So if you have any doubt, just don't use those titanium abutments. They just will not quite look right. Opt for the zirconium or the gold abutments. So that's one question answered. So now we go on and we look at another issue. The other issue is what? Is basically the soft tissue. How thick should those soft tissues be? We know that they need to be thick, but do we have a study that will actually tell us how thick it should be so we can predictably be able to measure this and know what the answer is going to be right at the end, without having to go through all this experimentation and testing and laboratory costs with different abutments? There is. It just came out, and this is what we're going to share with you. Basically, the bottom line is that you need a 2 millimeter tissue thickness. As long as your tissue is 2 millimeters thick or more, you can use whatever you want as an abutment and it's going to look fine. So please remember that.
So far we have covered all of the ceramic systems that are available in 2011. But we've got our last but not least ceramic restoration, which is the porcelain fused to metal, our working horse in dentistry. And we're going to see how can we get nice aesthetics and long-lasting restorations using this material. And is really this material obsolete or not? When we're matching teeth and implants, we'll see how can we use porcelain fused to metal in a very predictable way.
You remember this case where we showed you at the beginning 2 central incisors were restored. One was on a natural tooth and the other one was an implant that was restored. Do you remember that? In reality, the simplest way to restore or rehabilitate this patient is really with porcelain fused to metal crown, and that really is the workhorse of our practices. I would say a big portion of my dentistry is PFM based, and I'm not ashamed of it. I'm actually quite proud of it because I know it's predictable. It provides good longevity.
Yes.
There's a track record, and if we manipulate it properly, we'll be able to do this over a long period of time, and we're not going to get any phone calls on a Friday afternoon with a patient complaining of surprise fractures.
Absolutely. And let's see how can we get the best out of this material in a technical way. So what do you think? How can we get really nice aesthetics with it?
Well, in this particular instance, again, one important issue is the cutback. We need to be able to provide our technician with adequate space. Now, obviously, we have adequate space on the implant because the technician has full control of it, but adequate space on the natural tooth is provided by proper reduction with the aid of a diagnostic wax up, and that the technician uses that as a reference and can easily match those two abutments at the same time. They're made out of this high gold alloy type of material, and the gold alloy gives you that warmth, that natural dentin color that emanates from underneath. In addition, the other thing the technician can do is that on the natural tooth, he can cut back the facial aspect to a certain degree, up to 2 millimeters. This is called the Geller modification. And this 2 millimeter cutback allows light transmission and better aesthetics in the gingival area if the patient has a high smile line. And the warmth will come from the gold colored coping. We have the strength, we have the aesthetics, and we have the function, and we have the predictability with these type of restorations. And because both the substructures are the same material, it is easy. It can be done at once. So life is a lot easier and a lot more predictable because we know what we're doing, and cementation is also easier, isn't it?
Yes, absolutely, absolutely. You just have to cement it. You don't have to worry about bonding or any of that. It's much more easier, technically speaking.
So please don't be ashamed of using porcelain fused to metal crowns. We really should not be a victim of advertising. We need to be thinking about these things in a logical way so we can have practices that are based on sound principles.
Sometimes even rehabilitations with crowns and bridges. We showed you earlier that the best material to choose on fixed partial dentures or bridges is really porcelain fused to metal. And in this instance, I've showed you this case earlier, but I didn't show you the post-op. This is how the post-op was done. A full mouth, complex, comprehensive case using porcelain fused to metal. The underlying substructure is metal. And just to remind you of how the case started, actually, it was all porcelain fused to metal restorations that have been restored and replaced by porcelain fused to metal. They look fantastic in the patient's mouth, and really don't see any complaints in terms of chipping or delamination that often really with them because of the long track record history of it.
I'm particularly interested in the occlusive view of the final restorations. And the reason I'm interested in that is that when you look at this, it is impossible for anyone to be able to tell if these are zirconia, lithium disilicate, or they are PFMs. Because with proper handling and manipulation, they just look nice, bright, beautiful, and we have the track record with the longevity and the easy delivery of these restorations. Really, for me, it's a no-brainer. Porcelain fused to metal crowns do have a place in dentistry today.
However, there's only one drawback of it, Mamali, right?
That's right. The drawback, obviously, in 2011 again, is cost. Gold is fairly expensive, and that's why we've been forced to go and start using all these all-ceramic systems. But please consider the fact that these restorations have a low failure rate, and other restorations, particularly on molar teeth, as you've seen, have a higher failure rate, don't they?
Yes.
And because of that, the cost of replacement, the chair time, might be actually offset or be a lot more than the cost of doing a PFM. So please bear that in mind, and you need to really consider that cost to benefit ratio before you start using all ceramic crowns on molar teeth.
Full mouth reconstructions done on multiple implants. There's actually, up till now, I would say there's nothing better than porcelain fused to metal. Just have a look at this clinical case. It is a full mouth, comprehensive, complex case done with porcelain fused to metal. And you can see here the outcome looks very nice. I wonder, can you tell if this is zirconia or metal as a substructure?
Not at all. Simply, again, because the technician has adequate reduction, understands the material, has proper knowledge, and has the skills to be able to deliver this effectively. It's as simple as that. Knowledge and skill are combined to be able to deliver beautiful restorations.
Yes. And you see here in this picture, the maxilla is done by all porcelain fused to metal. The implants are splinted for better biomechanics, and really the aesthetic results and the functional results and the long term of it is very, very predictable. And we see here the rehabilitation, and with the metal framework, yes, as we said earlier, it's a bit costly, but on the long run, it is the best service that you can provide for your patients. And we see here the outcome on the patient's face. You really cannot tell what is it exactly. Is it metal or zirconia or whatever it is? It just blends very, very, very nicely.
Let's summarize zirconia restorations. When is the best time to use them? What is the best place to use them? Well, we've talked about this, and the summary is that they really should only be used on anterior teeth, incisors, or maybe even premolars. But as we go back posteriorly to the molar region, we start getting more chipping, more incidence of chipping. So if we really want to use them on those posterior teeth, we should really consider proper framework design, support for the ceramic as much as we can in all different areas. In addition, please also consider the all-in-Z option, where the whole restoration is made out of pure zirconia, polished or glazed, or both. The other advantage of zirconia is that you can conventionally cement it. You can just use normal cement, whatever it may be, glass ionomer, resin-modified glass ionomer, zinc phosphate, and cement it on, and it makes life a lot easier on the day of delivery. So in simple terms, you just do not need to etch the material. In actual fact, you cannot etch it. So that's why we use cementation as the means of delivery of these types of restorations.
And since you cannot bond zirconia-based restorations, then you have to rely on retention and resistance forms and everything we've learned in fixed pros from our dental schools. Now, we've talked earlier about the light transmission of zirconia. And because of that, you cannot use zirconia-based restorations on highly discolored abutments. And as well, you cannot use them on titanium or gold abutment implant restorations because they represent highly discolored teeth. Also, we would like to use them on malaligned implants, as we showed you earlier in the case where the implant restoration is a bit more towards the facial. And we're trying to match a high value opacious neighboring tooth. It's probably the best material to choose because of its white, because it's white in nature and opacious in nature.
Please also consider the soft tissues when using zirconia abutments. That plays a huge influence on the way your final restoration will look. It's important to consider the thickness of it. As long as you have a thickness of more than 2 millimeters, you pretty much will be able to mask anything that goes on in terms of screw shape, form, size, and color, or the abutment color, or the zirconia color, in fact.
So less than 2 millimeters probably is best to use zirconia-based restorations for better aesthetics.
Exactly. If you have thin, soft tissue, I would recommend using a zirconium abutment. That would be the safest in terms of aesthetics, at least. And we have particular instances when the patient will come in and they will ask for these pasty white looking restorations. We get that a lot in Southern California. I'm sure it's going to start spreading across the world. And if that's the case, zirconia will definitely be able to give those types of opaque looking restorations for you. So in that regard, it can be an advantage. So let's take a look at PFMs. PFM gives us what? It gives us a good masking ability. Right, Anas?
Yes. In fact, it's the gold standard, I believe. I mean, there's nothing better than PFM to use as a masking ability.
Right. So let's look at some instances where masking ability is really essential. A patient like this recently walked into our clinic. The teeth look black. There is no material, no old ceramic material that can mask that. The only material to be used here is PFM. It's not even a question, it's not even a debate.
Absolutely.
Let's take a look at another situation. Here, this post cannot be retrieved. The only way we can restore this effectively and simply without too much headache is with a porcelain fused to metal crown. Again, no debate. How about in this situation? We got multiple substrates, different colors. And how are we going to manage this case? Again, PFM, it's simple, it's easy. So please do not discount porcelain fused to metal crowns just yet. It's a fantastic tool in restorative dentistry.
Now, we said earlier that the two main reasons for success of our restorations and our outcomes is the knowledge, and which is the material selection, and also the proper handling of the material, which is the skills of the operator and the technician. In this instance, what you see on the screen is a patient that actually walked in, and it was quite interesting to see the two lateral incisors, where it demonstrates the improper handling of porcelain fused to metal. You see the right lateral incisor, how the tissues are really not reacting very well. There's probably a violation of biologic width. While on the other side of the screen, or the other lateral incisor, the left lateral incisor, the lateral incisor actually is opacious, and it, in terms of handling and providing space from the technician, from the operator to the technician, is really not enough. And you see how the outcome is very opacious. You see from the palatal view, you see how the two restorations are very opaque.
And you can see the technician has tried to cheat and overcome the problem with a lack of space by bringing that lateral incisor forward and overlap it. But even that was not enough. So good communication between the dentist and the technician is essential as proper planning to be able to achieve ideal results with porcelain fused to metal crowns. So really, it's not the material, it is the operator's skills that can be at fault here.
And also we showed you this case earlier when we first started our presentation, where an improper as well handling of the porcelain fused to metal, where the restoration was been replaced by a full ceramic. Again, PFM is not to be blamed here. It's the skills of the operator and the technician are to be blamed. Still, porcelain fused to metal are the working horse in dentistry, and we can get beautiful results with them by proper handling. And we showed you a lot of cases where we can obtain that. The best material to mask in this instance,
it's porcelain fused to metal crowns. We have multiple tools to be prepared, and if we start using translucent material, we may open Aladdin's cave. We're going to get into a lot of trouble trying to match everything. So really, porcelain fused to metal crowns in this instance will make our life a lot easier. Predictable, so we need to be efficient in our dentistry as well as logical in what we do. So to summarize porcelain fused to metal crowns, the few points that we like to cover because it's important. The first point is that you can use it everywhere, can't you? For single units, in addition for fixed partial dentures, for bridges, or even for huge reconstructions they could be used.
The very good thing about porcelain fused to metal is you can solder it. And we can also do what we call the post-soldering technique as well, which is something that you cannot obtain with all ceramic restorations, to provide passivity of seating of your restorations on teeth and implants. And of course, we cannot bond porcelain fused to metal, so you have to cement them. And that's also a good thing. I mean, you can look at it as an advantage because it makes your life much easier. And it is the gold standard for masking. There's nothing better than porcelain fused to metal for masking highly discolored dentition or abutments. And implants with large frameworks, it's the best when you want to splint implants for better biomechanics. There's really nothing better than porcelain fused to metal.
So on that note, we'd like to thank you for being with us throughout this long presentation, and we hope it's been useful for you and it's been good information to take to your practices.
It's been a great pleasure preparing this presentation and presenting it for you, and it's been a great pleasure working with Dr. Reshad, and I thank you very much as well.
And thank you for working with me, Dr. Aloum.
Thank you, mate.
For more education programs, visit the Guide Institute at www.guidedental.com.